Welcome to our series on how to ace the paramedic job interview. Today's focus is on answering the challenging question, how do you handle language barriers when communicating with patients? We'll provide a sample answer and explain what the interviewer is looking for. Let's get started. How do you handle situations where language barriers may prevent clear communication with a patient? The interviewer wants to know how you handle situations where you can't communicate with a patient. They want to see if you have strategies for overcoming language barriers or if you are willing to seek out someone who can translate. Now, let's explore an excellent answer to this question. In my role as a paramedic, I've encountered patients with language barriers on several occasions. My approach to handling these situations starts with recognizing that effective communication is essential in providing quality patient care. To begin with, I would try to identify the patient's primary language using any available resources or interpreters. If their primary language is not my own, I would enlist the help of a qualified interpreter, a family member, or a friend who can translate for us. In cases where there isn't enough time to find an interpreter, I would use visual aids and nonverbal communication techniques, such as pointing to body parts or using gestures to convey my message. This method has been effective in communicating basic information such as what happened to the patient and what we plan on doing to assist them in their situation. It's also important that I remain patient, respectful, and empathetic towards the patient and their family, as it can be daunting for them when they're in an unfamiliar place and cannot communicate properly. In such instances, I take the time to listen to their concerns and reassure them that we will do everything to make them comfortable, even when there are language barriers to navigate. Additionally, I would strive to improve my own language skills and cultural competence to be better equipped to communicate with patients from different backgrounds. It can help to learn some basic phrases and commonly used words in languages spoken in my area of operation. And that's just one way to handle language barriers in healthcare. I hope you found this example helpful. Be sure to check out more of my videos and the rest of the playlist for further tips and tricks. Don't forget to leave your feedback in the comments below. Remember, confidence is key in interviews. Visit beconfident.io for more confidence-building techniques.